Elbow arthroscopy is a surgery performed with small poke holes safely placed around the elbow, an introduction of a camera and instruments through those poke holes to do work around the joint itself. It is soft tissue sparing in that we're using small poke holes and not having to open up the entire joint, but it does have a very narrow indication for when we can use it. And so in my practice and in most elbow surgeon practices, we use it for addressing mechanical symptoms associated with loose bodies, early arthritis. We often use it in order to address osteochondral lesions or cartilage injuries in our athletes. And then finally, in a small subset of fractures along the joint surface, we can use it to improve our visualization and achieve better fixation of those injuries. With that said, it's not a surgery that can be applied to all injuries about the elbow, and things like distal biceps ruptures, triceps injuries, large-scale end-stage arthritis that may require total elbow replacement, nerve compressions associated with things like cubital tunnel and our ulnar nerve. All of those will require a more open approach in order to safely and effectively achieve the surgical result.